Welcome to National Blood Service Zimbabwe. National Blood Service Zimbabwe is on number 53 Marowa Street in Harare. We are going to take you through the blood donation process and also a tour of the labs. Good afternoon, viewers, and welcome to Health Matters, a program which focuses on every issue concerning our health. Today, we are going to focus on how the COVID-19 pandemic has affected our local blood bank. In the studio today, I have Ms. Marowa, the Chief Executive Officer for National Blood Service Zimbabwe. Welcome to the program.
Thank you very much, Faith. Thank you for inviting me to this program. I look forward to be of service and to answer questions and also to allay the fears of Zimbabweans. Good afternoon.
Thank you. Ma'am, would like to know just a brief overview about the blood bank at the moment. What's the current status due to the COVID-19 pandemic? Are people, or rather your donors, coming through to donate blood?
The COVID-19 pandemic has really had a very significant impact on the National Blood Bank, and we really have felt it from last year, and it has progressively become worse, though we are trying our best to mitigate against those negative effects. The first thing was the lockdown that was introduced on March 27, 2020. This meant that people could not move around freely, meaning that they couldn't access our static clinics in the 5 branches that we operate from in Harare, Bulawayo, Masvingo, Mutare, and Gweru. That also meant that we immediately saw a reduction in the number of units that we're collecting every day. Schools were also closed, and all students from higher institutions of higher learning and also tertiary institutions had to go home. And this is where we are getting 70% of our collections from. So immediately that was a big vacuum created by the closure of those institutions. We could not go into the schools and tertiary institutions to collect blood. Third, it was also very difficult for us to move from our own areas of operation to move to where the people were. We had to get clearance, and it took time to get that special clearance and for our mobile teams to be allowed to visit the various areas. But each time we would go now to the places where the potential donors would be, sometimes it was not easy for them to come to the collection site. If we are encamped at a shopping center, it was difficult for the people to get out of their houses and make their way to the shopping centers. So that made us suffer a deficit of over 60% of collections that we had targeted for last year. And you can imagine the impact of 60% reduction is quite huge. It meant we were not able to fulfill the orders that we were giving out to our institutions, and therefore there was immediate shortage of blood and blood products in the institutions. So that was the biggest impact, and it still persists up to today, although we've seen some kind of a positive response. The donors are there, they are unable to come to us, or sometimes we are unable to get to where they are. So yes, we've been very much negatively affected by the pandemic.
We understand that the National Blood Service Zimbabwe deals with blood and blood products. How has been the blood products affected during the pandemic, or rather the demand for the supply of the blood products?
The supply has not gone down, simply because people are still ill. People are still getting conditions that require blood transfusion. Road accidents happen, childbirth happens, chronic diseases are there. Anything that has resulted in patients needing blood before still exists with or without the pandemic. So the demand has not gone down. It is us that have failed to supply adequately because of the challenges that I have mentioned. So we are still very much in need of blood and blood products. These blood products we are talking about, in fact, I should talk of components which are substances that are made from the blood itself that has been donated by an individual, which is subsequently processed and reduced into different components. Yes, we have products that are manufactured in specialized factories, which we import also from outside of the country. These are also very scarce at the moment, due to various challenges such as the logistics and necessary for that, the foreign currency demands, and other challenges that we face. So yes, the demand for products and the blood itself has not diminished. It's the supply side that has been affected.
Okay, so what are the strategies that as your organization has been doing to try to bring the blood drive or maybe push for blood drive?
As an organization, we've been working closely with the law enforcement agents and also the governance structures within the different provinces where we operate from. This means that we are able to go in and negotiate with them, and they've been very welcoming, they've been very receptive of the blood program. That has made it possible for us to get special clearance from the police. We have a letter that we got from the police to say that our teams can continue to move from place to place. Our blood donors also can move from their homes to our centers to make their precious donations. And also that generally as an essential service, we shall be recognized as such. And in fact, when lockdown was announced at the beginning of this year, we were listed as one of the essential services, which is a plus for us because it means that someone is taking notes. We've also tried now to go into social media engagement of our blood donors to make sure that we continue to interact with them and to tell them where our mobile teams are each and every day. So we've done a lot of digital marketing of our blood program. We also come to different radio stations. So as an organization, we realize that we cannot continue to do business as usual. We cannot continue to rely on traditional methods that we've always used over the years. We needed, therefore, to go outside of our comfort zone and come up with something that could help us to communicate with our blood donors. So the first thing we had to do was to enhance our digital marketing, which meant the use of all digital platforms, including social media, to talk to our donors. One of the biggest things we did was the Facebook blood donation feature, where we partnered with Facebook, such that any user of Facebook application can sign up and be able to be notified whenever they need to make a blood donation to the center that is nearest to them. That is one of the biggest things that we did in 2020, and it has been helping a lot. We've also been making sure that our Facebook page itself, our Twitter handle, we've been using them to communicate, as well as also use both the traditional and also the digital media to disseminate information on blood donation. So we've been going to television stations, radio stations, online publications to make sure the message on blood donation is getting out there. We've also been working with the governance structures within the various provinces. If we are in Mutare, we will engage the councillors, the police, and everybody who is involved so that we are able to get passage for ourselves and also our blood donors. When necessary, our vehicles will actually go in and pick the blood donor from home, get them to donate the blood and take them back home. These are things that we had not anticipated, but we have had to do that. Police have given us a clearance letter such that our mobile teams are able to move freely from our centers to the place of collection. And likewise, our blood donors as well have been getting passage. Yes, they have to produce the SMS message from us, or they have to have a letter that has been facilitated by ourselves. And there's been a lot of cooperation at the roadblocks to make sure that our blood donors have been able to come. Also, we've been trying to make sure that we get to where the people are. So that's what we've done so far.
Okay, you have mentioned a lot about Facebook pop-up notification for blood donation. How was the response? Because a lot of people take some social media alerts for granted. How has it been for you?
It has actually been very good because it has helped our blood donors to connect with us and to be able to link up with our communication department and to iron out issues of access, for example. Maybe some donors may not be aware that we can facilitate for them to come and donate blood and go back. But when they get that Facebook pop-up, they immediately click on that and link up with the communication section. So yes, that is really giving us results. We've been collecting the data and we'll publish it at the end of 1 year to say how many people came as a result of seeing this notification on their Facebook pages. So that information will come when we've done that survey, but it's been very positive.
The National Blood Service Zimbabwe has been known well for their men's splash and ladies gala. How has it been during this lockdown?
Unfortunately, we've had to tweak it again because of the need to make sure we do not have people aggregating within a confined space. So where we were expecting to have 100 donors coming in on one day, we have now gone into scheduling. Nowadays, we don't encourage people to simply come in numbers because it then defeats the whole point of social distancing or physical distancing. So we will schedule our patients appropriately. We will have our splash over 3 to 5 days and have maybe 20, 30 people coming in per day at a given time. So each donor knows they're coming in at 9 o'clock or at 10 past or 50 or quarter past until we've exhausted our list. We've had to come up with a contact center where we call in these donors and schedule the appointments. It's innovations that we didn't have before that we've been forced to do to make sure the splash continues, but there's no more aggregating of donors in one place on a single day. So that's the variation that's there.
Okay. A lot of people are interested in knowing if you are maybe offering testing facilities to your donors.
No, we are not doing COVID-19 testing for donors, if that's what you are asking about. Not at all. We are still doing the donor screening as we have always done, and we still call upon our donors to be as faithful as they have been to tell us their medical history, whether they suspect that they've had contact with someone who's been infected with COVID-19, whether they've cared for someone who's been infected with COVID-19, whether they themselves have been infected with COVID-19. We've had just additional questions attached to our usual donor screening questionnaire, but we do not offer COVID-19 testing for the blood donors. However, as an institution, we are also exploring the issue of offering COVID-19 testing to the public at a much subsidized cost, but this is still work in progress. It will not be specific for donors, it will be for anybody. I will keep you posted as that develops.
Okay, because a lot of people were worried to getting transfused. Maybe, you know, a lot of people are asymptomatic. They may have COVID, but they might not show any signs. So when they come through to donate blood, a lot of people who are going to be the recipients are worried about that. That's why I had raised that point. Also, a lot of people want to know the gazetted price for the blood.
Let me start with the issue of the worry about COVID-19 infection. First and foremost, let me make it clear that COVID-19 is not transfusible by blood. You cannot get infected by receiving blood from a person who was COVID-19 positive. It is not a blood-borne infection. It is an airborne infection. So let's get that cleared first. Then moving on to the issue of the user price, we don't call it cost. It's called a user fee. We charge a user fee of $120 payable at the prevailing bank rate. Why do we charge $120? It's because that's how much it costs to take the blood from the donor, process it, and make it ready for the recipient. We are a not-for-profit company, therefore there is not a single cent of profit there. It's simply recovering of the cost that has gone into producing that safe unit of blood. That is what we are getting so that we can continue the cycle of providing this blood to the next recipient.
Who needs blood?
You, me, the next person. Anybody can need blood at any given time. But generally, we're looking at people that have conditions that affect their body's production of blood, or people that have lost significant amounts of blood due to trauma, due to injury, or due to medical procedures such as an operation. Those are the people that need blood. You will have pregnant women that will bleed during childbirth. And those conditions can lead to death within a few minutes or even a few hours. Those people will need transfusion. We have victims of road or work-related accidents that will have injuries leading to a massive loss of blood. They will need a transfusion. You will have people who will have cancers that require them to be transfused. Patients on dialysis who occasionally need transfusion. So we have many categories of people. Children that suffer from malaria requiring exchange transfusion. So a whole lot of people will require transfusion due to various medical and health-related issues.
Very informative. I wanted you to take us through the blood groups a lot of people just know blood as blood, but you categorize blood. May you please take us through that?
When we look at the normal blood of any human being, the red blood cells contain special proteins on them. These special proteins are what are used to categorize each blood into a specific blood group. So you've got proteins that are called protein A, protein B. Then you have a combination where people have both A and B. They become blood group AB. Then you have people who do not have that protein and their blood is then categorized as O. It lacks these proteins. So then you have 4 major blood groups of A, B, O, and group AB. Then in addition to that protein, there's a secondary protein called rhesus. It's positive or negative. If you have it, you are positive. If you don't have it, you are negative. So within each blood group, you can have a group A, positive or negative. Group B, positive or negative. A, B, positive or negative. Group O, positive or negative. Then we talk about what we call our universal donor. Generally speaking, you should receive blood from people that are the same blood group as you. However, blood group O lacks the proteins that I talked about. So that blood can be given to any blood group. That's why it's called a universal donor. The most universal is the group O negative, which lacks all these proteins. However, the blood group O positive is more common than everyone. 52% of the Zimbabwean population is blood group O rhesus positive. So that's why we talk of a universal donor. It's the group O which can be given to any of these other blood groups. So generally speaking, that's what the blood group it talks about, but it's a very intricate and scientific process which I cannot explain to you in just 2 or 3 minutes.
All right. Thank you very much, ma'am, for coming to the show. What are you appealing to members of the public? We are running out of time, but we just want you to maybe give us your appeal to the members of the public.
I just want to appeal to Zimbabweans to continue to come and donate blood. We are appealing for our usual and also new donors that are 16 years and above, weighing minimum 50 kgs and in good health to come in and donate blood. Yes, people are peddling certain myths about blood donation, but we are here. If you need information, seek it from us. Let's save lives out there. Let's give blood altruistically because any one of us can need it at any given time. So I appeal, if you have questions, contact me, contact the National Blood Service. We are happy to answer questions, to arrange logistics, but please come and donate blood. You don't know whose life you are going to save. It could very well be your own life next time. Thank you.
Thank you very much for coming to the show. Hi, Emily.
Hi, how are you?
I'm fine, thank you. What motivated you to give blood?
Well, so I got a message that the blood transfusion services needed some blood. They were in short supply, and it had been a while since I had donated, so I decided to come.
Okay, so how many times have you donated blood so far?
This would be my 6th time. Yeah.
Are you pledging 25?
Yeah, sure.
Thank you very much.
You're welcome.
I'm very well, thank you very much.
Where are you from?
I'm from here, Canada.
Okay. What motivated you to donate blood? Because you look like a mature woman, and a lot of women your age might not be donating blood.
Well, to start with, my daughter who's here with me has been donating blood over the years, but I haven't been myself. And when I came here, I was supposed to drop her off. But then when I then saw that, I'm right here, why not? There are so many people out there that require blood. There are so many people that will benefit. And now look, with COVID, there are so many restrictions that are out there, meaning that blood transfusion services, they actually don't have the blood that is required. And the second thing also why I donated is I saw an advert in one of the chat groups that I belong to, and I thought this is the best thing that I can do now that we're doing nothing. we can actually contribute by giving blood to the nation. So I'm
Since
very
it's your first time,
Yes,
how
it's-
do you feel?
I feel so great. It's amazing. I was scared, but now I wish I'd done it so many times before, and definitely I'm going to continue doing it.
Thank you
Definitely.
very much.
For this time, so like there's nothing that can stop me to donate during this time as well. I should do it before.
How many donations have you made so far?
I've made 8 so far.
Okay. Thank you very much, and thank you for convincing your mom.
Sure, you're welcome.
There we had it, viewers and listeners. Blood is life. Let us keep donating blood. You may save a life. See you again next week, same time and same place.